So, Mrs. Hernandez, I understand you're here because you have some stomach trouble. Is that correct?
Yes, I have, every time I eat, I feel, puedes decirle que cuando como se me atraganta algo en la garganta y también en el estómago.
Well, she said that she feels like something's stuck in there, in her stomach.
Stuck? What do you mean by stuck? Like there is food there that you're having trouble digesting, or what is stuck?
¿Tienes algo en el estómago ahorita?
No he comido desde anoche.
She hasn't had dinner since last night.
No, that's not what I meant. What I meant was, are you having trouble digesting food after eating?
¿Cómo?
Quiere decir...
Working in healthcare, most of us probably at one time or another witnessed a scene like this. We figure it's fine if we manage to get our job done however we can, usually by asking a patient's child, relative, a fellow employee, or even strangers to help interpret. This is not only unacceptable here at UCLA, it's dangerous. There are countless examples nationwide where incorrect interpretation has led to a patient not getting the proper care, getting the wrong care, or even dying needlessly. By the end of this video, you will know why and when to use a qualified professional interpreter and how to access language assistance at UCLA Health.
Here in California, we serve one of the most diverse patient populations in the entire world. Approximately 6% of our patients identify themselves as LAP or Limited English Proficient. Legally, we are mandated to provide language assistance for each of these patients at no cost. LAP patients have a federal right to an interpreter, guaranteed by Title VI of the Civil Rights Act of 1964. Denying interpretation to such patients is considered discrimination in the eyes of the law. In addition, California law prohibits the use of children as interpreters in communicating medical diagnosis or treatment in hospitals, clinics, and doctors' offices that receive state funding. The Joint Commission and the Americans with Disabilities Act also mandate that we accommodate patients who have vision, speech, hearing, or cognitive impairments. So in addition to foreign language interpreters, we must provide sign language and other services to meet the individual communication needs of each patient at each and every encounter. As with foreign languages, using family members to interpret for the deaf or hard of hearing patient is not encouraged, but the patient may elect a family member to interpret. The provider in this instance can also elect to have a professional interpreter present for quality assurance.
$71 million. That's what the payout was for one of the most noted cases of interpreter error. A young Hispanic man in Florida became a quadriplegic because of one misinterpreted Spanish word, intoxicado. Paramedics thought the man was drunk. In reality, the word means something else, and his medical team failed to diagnose a brain aneurysm that led to his paralysis. If a qualified medical interpreter was made available, the outcome could have been a lot different. Medical interpreters are specifically trained in medical terms and follow uniform codes and protocols standard in health systems across the nation. They will respect patient confidentiality. They are trained to repeat everything the healthcare provider says and everything the patient says. They do not summarize, paraphrase, add to, omit, or change the meaning of words. Nor do they say what they think the patient or the caregiver means. As in the following example.
Ms. Rodriguez, I understand that your religious beliefs don't allow you to accept a blood transfusion, but this is a very big operation. There's a significant chance of blood loss during the surgery. If you don't consent to a blood transfusion, I'm afraid it could result in your death.
Dice que la cirugía es muy grande y si no aceptas la transfusión de sangre te podrás morir.
Yo no voy a aceptar transfusión de sangre. Eso va en contra de mis creencias.
She still refuses the transfusion.
Well, maybe we could try blood products. Can you explain to her that if she has significant blood loss during the operation, we could give her platelets or albumin?
Dice que te pueden dar parte de la sangre. Eso te podrá ayudar a parar de sangrar.
Nada de eso. Eso va en contra de mis creencias. Ya lo dije.
Entonces le digo eso, que te deja morir.
Sí, dígale eso. De por sí todo va a estar bien, ¿sí?
She said she would like that. She says that everything will be okay.
So she'll sign the consent for the transfusion of blood products?
Yes.
Okay.
Firma.
Using family, friends, minors, untrained volunteers, strangers, or other patients may result in breach of confidentiality, may result in patients being reluctant to fully disclose critical information, increases hospital liability, may result in additions, omissions, and changes in meaning, may result in misinterpretation due to lack of medical vocabulary, and it may result in traumatizing children who are forced to convey difficult news to family members. Here's how the scenario you just saw would have turned out had a professional interpreter been used.
Ms. Rodriguez, I understand that your religious beliefs prevent you from receiving a blood transfusion.
Señora Rodríguez, yo entiendo que sus creencias religiosas no permiten que usted reciba una transfusión de sangre.
But I want you to understand that this is a very big surgery.
Pero la cirugía que le van a hacer hoy es una cirugía muy grande.
And there's a significant chance for a lot of blood loss during this operation.
Hay una gran posibilidad de que usted pierda mucha sangre durante esta operación.
And if you don't consent to a blood transfusion, I'm afraid that it could result in your death.
Yo me temo que si usted no acepta una transfusión de sangre, esto podría resultar en su fallecimiento.
No, yo no voy a aceptar una transfusión de sangre. Eso va en contra de mis creencias.
I'm not willing to accept the blood transfusion. That's against my beliefs.
Well, maybe we could try something else. If you have significant blood loss during the operation, we could try blood products like albumin or platelets. Would you be open to that?
Bueno, podemos intentar esto. Si usted tiene una pérdida de sangre importante, podríamos intentar darle productos de sangre como albumina o plaquetas.
No, nada de eso. Nada de eso. Eso va en contra de mis creencias, nada.
Nothing like that. That's against my beliefs, nothing.
No te puedes dejar así. Por favor, acepta esto. Si no por ti, por tus hijos.
No, va en contra de nuestras creencias y va en contra de la palabra de Dios. Nada, no.
Companion is saying, please accept this, if not for yourself, for your children. Patient is saying, no, I cannot accept this. It's against our beliefs and against God's word. So no, nothing.
A trained interpreter will want you to speak directly to the patient, looking at them as you communicate, and they will ask the patient to do the same. They will speak in the first person, and this will allow the caregiver to say, for example, "Where does it hurt?" instead of "Ask her where it hurts." Trained interpreters ask caregivers to pause frequently, to allow the interpretation to occur without rushing, repeating, or mistakes.
Good morning, Mr. Victor. I did go through your blood work and imaging this morning. Your imaging is okay.
صباح الخير أستاذ فيكتور. أنا راجعت التحاليل والأشعاعات بتاعتك. الأشعاعات بتاعتك معقولة.
The blood work showed mild elevation in your liver tests.
تحاليل الدم أوضحت إن أنت عندك.
If an interpreter has a question, they will make it clear to all parties.
It can also cause esophageal varices and liver cancer.
وممكن أيضا تسبب دوالي في المريء وسرطان في الكبد. Excuse me, doctor, the interpreter would like to ask you to say that in layman terms so I can convey to the patient in a way that he can understand it. أنا بقول للدكتور إن يقول الكلام اللي قاله بلغة عامية علشان أقدر أنقلها لك بصورة حضرتك تقدر تفهمها.
Esophageal varices is when there is.
And if they don't understand what the patient is saying, they will also inform the caregiver.
And that could be due to the underlying hepatitis C.
وده ممكن يكون بسبب فيروس سي اللي مسبب التهاب الكبد.
إزاي جالي ده؟
How did I get that? The interpreter would like to ask the patient, what does he mean by that? بتقصد إيه بده؟
التهاب كبدي؟
Hepatitis C?
Okay, hepatitis C is
In some instances, the interpreter may ask the caregiver to elaborate if they feel the patient has not been given enough information.
Now, based on your physical exam, blood work, and imaging, you can safely wait till the new medication that's gonna be out next year.
بناء على الكشف عليك والتحاليل والأشعاعات أنا ممكن أقول إن حضرتك ممكن تنتظر It's okay في أمان لغاية السنة الجاية ما تظهر الأدوية الجديدة.
استنى السنة الجاية؟
Do I wait until next year?
Yes.
أيوة. Excuse me, doctor. The interpreter noticed that the patient is a bit anxious about the wait until next year. So if you don't mind to reassure him about the fact that it's okay to wait until next year.
Okay.
أنا لاحظت إن حضرتك قلقان على موضوع الانتظار لغاية السنة الجاية فطلبت من الدكتور إن هو يشرح لك أكتر علشان يطمنك.
Okay, hepatitis C does not progress that fast.
Remember, interpreting and translating are not the same. Interpreting pertains to spoken language, while translating applies to written documents.
Here is what must be done at each encounter with a patient who may need interpreter services, including when they call to make an appointment. Ask, in what language do you prefer to discuss your healthcare? Please use the language identification cards to help you, which are available at every nurse's station and front desk. Also, use any translated materials in the patient's preferred language, which are found on the Forms portal. Once you know what language the patient is most comfortable with, request an interpreter.
Hello, this is Regina. I have a patient, Mrs. Gomez, on the line who would like a Spanish interpreter to be present at her next appointment.
To make sure an interpreter will be available for your needs, they can be requested in advance in many situations, like pre- and post-surgery, discharge planning, teaching, consults, informed consent discussions, and family meetings. Whether you work at the front desk, at a call center, or whether you're a physician, nurse, or pharmacist, the potential need for an interpreter is something you should always be thinking about, and preferably in advance of the patient's arrival. At the start of each day, it may be a good idea to take just a couple of minutes and ask yourself, does an upcoming patient need an interpreter? Another good time to ask if they would like an interpreter at their next visit is when the patient is making a follow-up appointment. For more information about our range of interpreter services, including for the hard of hearing, video interpreters, or the types of devices available to you, please contact our Interpreter Services office. UCLA provides training for employees and others who already speak a foreign language and are interested in becoming qualified interpreters in that language. Many employees have already taken part in that training program and now are able to offer an extremely valuable service to their departments and patients. If you'd like more information on how to become a qualified interpreter, please email us at interpreters@mednet.ucla.edu.
Interpretation is not something to be taken lightly. Correct interpretation can make a tremendous difference in not only our patients' health outcomes, but also in how they feel about the kind of care we provide here at UCLA. Thank you for watching this video, and thank you for helping heal humankind one patient at a time.